Atopic dermatitis is a really interesting condition because it encompasses a lot of aspects of skincare and skin disease. Atopic dermatitis, which people also call eczema, is an inherited sensitive skin. It's not diseased skin, it's super sensitive skin. So if you imagine somebody that has a little scratch, and if your skin is normal, you get the scratch and you don't think about it anymore. Somebody with atopic dermatitis gets a scratch and it starts to itch, and then they can't stop scratching it. And the scratching goes on and causes redness and a rash. So things that might not bother someone without atopic dermatitis will bother the people with it. So if they are using fabrics that are aggressive like wool, they may get itchy. If they're near animals, they may be sensitive to, they'll itch more, whereas a normal person without it won't itch. So the main thing is super sensitive skin. The next thing is when they get little infections on their skin, they tend not to fight them as well. So not only having sensitive skin, they have skin that will get prone to infection once it gets scratched. So you can prevent a lot of this by changing the environment in atopic dermatitis. So atopic dermatitis is super sensitive skin, and then you can modify the problem by correcting the environment. So I'll go into some of those aspects of correcting the environment. So people with atopic dermatitis often are drier than other people. They don't hold on to water in their skin very well. So people with this condition who clean themselves too well will promote itching, which then promotes scratching, which leads to the rash. You don't always have to have itching, but it usually will accompany the condition. So it's often people that are too clean will get flare-ups of their atopic dermatitis. And yes, a person can be too clean. They pull all the natural oils off their skin. That makes it dry. That makes it more prone to itching. Certain soaps will make it worse. Deodorant soaps, aggressive soaps, abrasive soaps will make the skin more sensitive. So it's environmental, which is how you can fix your skin through what you do. And then you're dealing with your family history and your parents and grandparents, which is something you can't really change.